We joined Luann just a little over a month after she started treatment with the lower orthotic. As before, she begins by discussing how she's feeling.
I've gotten so used to it feeling this good now that it's hard for me to remember the way it was. Pain-wise, I don't have any. I don't have any of the stiffness in the shoulder. A few months ago, I was just struggling with it, and I would almost cry some days with the pain in my shoulder.
Now, your chief complaint is just being sleepy.
Sleepy. Tire out easy because I'm sleepy. I get up tired. You know, I get up in the morning thinking, oh shoot, I can't.
Now, we're going to be giving Luann a completely different kind of orthotic. One that has all the characteristics of her lower one, but also brings the lower jaw farther forward during sleep. It does this by attaching to the upper teeth as well. You'll notice that speaking with this new nighttime orthotic is not quite as easy as with the lower one only. We're going to join Luann as she's putting this orthotic in her mouth for the very first time. That's exactly right.
Back of my throat feels more open. It's amazing. Because I feel like when I breathe, it's really, I feel like they're deep breaths. Like, you know, it's not shallow. I feel like a real expansion of the lungs.
Now, you noticed breathing easier when you had the lower orthotic that first time. Can you compare this to that?
This was all open here. All opened here for the first time. I didn't realize how closed that was until I got that piece. I can walk there without getting out of breath. This is different. This is, I feel almost like I can feel clear to the base of my lungs. I don't know if I can just feel it through my whole body. I can just feel it. Like every muscle is responding to this. Every muscle is responding.
So with this new orthotic, Luann notices even greater ease of breathing than she did with her lower one. While Luann's new orthotic is designed to be a sleep appliance, because it can create such an increased ease of breathing, some patients actually choose to wear this kind of an orthotic even during waking hours. Just like the lower orthotic, this nighttime orthotic requires multiple appointments to make sure that it's adequately adjusted. We'll join Luann a final time several months later when she's at our office for a follow-up appointment.
My sleeping is wonderful. I will tell you, I sleep wonderfully. Before I was like, ooh, all day long. Give me something to keep me going. Give me some coffee, give me something, you know. I don't do that now. I can go, I can get up and say, okay, I get this done, and I get up and I go. I'm on my feet and I'm on my way. Sleep is amazing. My husband asked me today, how's your sleep? I said, it's great. It is, it's great. I can't remember the last time I slept this good. And I feel very rested when I get up in the morning. Since I started with all of this, I've lost about 14 or 15 pounds, maybe 16. And I haven't done anything different other than to sleep.
Luann's comment about losing weight after treatment is not unique. So many times lack of sleep is the missing link in weight loss plans. In fact, poor sleep is one of the known risk factors for obesity. So let's review the common symptoms that can accompany a narrow airway space, that narrow space directly behind the tongue through which everything we need for survival must pass. Chronic headaches, pain or tightness in the temples, pain or pressure behind or around the eyes, a feeling of tightness or pain in the jaw joint, which is often referred to as TMJ, pain or a feeling of fullness in the ear, tightness or pain in the neck, shoulder, the shoulder blade area, a feeling of tightness in the throat, or sometimes the upper chest, chronic feelings of anxiety or being on edge, even with no logical reason for these feelings, shallow breathing, or sometimes even forgetting to breathe, occasionally choking on food, water, or saliva, difficult time swallowing large pills. Now certainly not everyone has all of these symptoms that I've just listed, but in Luann's case, she really was almost a perfect storm in that she experienced most of these symptoms that contributed to how poorly she was feeling. Now sadly, these common but diverse symptoms are rarely looked on as having a common cause. It's very typical for our patients to come after having seen doctor after doctor in an attempt to get to the bottom of why they feel so bad. Usually these diverse symptoms are treated with various medications such as pain pills or antidepressants in an attempt to diffuse them. It's not unusual for patients to come thinking that they're crazy because their healthcare provider implied that they were, since the medications they prescribed either didn't help or even made things worse. I sincerely hope you've enjoyed following our treatment process with Luann. I'm truly grateful to her for allowing the video record of her treatment to be used in this manner. I assure you, her main motivation in doing so was that other people who suffer from pain and poor sleep can get the relief that she has. So if you're constantly complaining of daytime fatigue and sleepiness, or chronic head, neck, or shoulder pain, or tightness, call for a consultation. We can help you feel better.